Hi, I'm Dr. Talia Marcheggiani, and this is Microdosing for Depression, Research on Psychedelics for Mental Health. So this article is for informational purposes only. My friend Nelson, which is not his real name, was depressed. Depression frequently came in and out of Nelson's life, but this last bout was the worst. Severe job stress compounded by issues with his relationship sent Nelson into a downward spiral, leaving him broken, sobbing, and exhausted after engaging in even the simplest of tasks. Sadness and a feeling of doom rushed in to greet him at the end of each sleepless night. Nelson gained weight, despite never truly feeling hungry. His face appeared sunken and swollen. Despite sleeping 14 hours a day, dark circles hung under his eyes. Since focusing and concentrating on work was impossible, he asked his psychiatrist to help him apply for mental health leave. Nelson was granted sick leave, as well as a prescription for Effexor, and a recommendation to get as much rest as possible. After a year, Nelson felt worse. When rest and the medication weren't working, he started exercising vigorously. He hired a nutritionist who cleaned up his diet, and he started taking fish oil and a B complex, among other supplements. Even then, he still struggled. The hopelessness was still there. Returning to work at this point seemed impossible. Nelson opened up to a friend about his struggles. "I went through a similar thing a few years ago," Nelson's friend confessed, "and the thing that helped me the most was microdosing." Microdosing, or taking small doses of psychedelic substances like LSD or psilocybin-containing magic mushrooms, entered the public consciousness in early 2015 after James Fadiman, PhD and author of the Psychedelic Explorer's Guide, appeared on the Tim Ferriss podcast. Microdosing involves taking subperceptual doses of a hallucinogen like LSD or psilocybin cubensis magic mushrooms that contain the hallucinogen psilocybin. A subperceptual dose means that while these substances still exert their effects, they don't produce a noticeable hallucinogenic high. According to Paul Austin at the Third Wave, people microdose for two main reasons. One, to remove negative mood states, such as depression, anxiety, PTSD, addiction, and ADD. And two, to increase positive mood states, such as flow, creativity, improved productivity and focus, and sociability. Microdosing has been used experimentally in individuals trying to quit smoking and to heal depression. After listening to the podcast and reading some of the articles his friends sent him, Nelson managed to obtain capsules containing 200 milligrams of dried psilocybin mushrooms. Procuring these substances is still illegal, but Nelson figured he had nothing to lose. When I caught up with Nelson, he was already a few weeks into his microdosing regimen. I asked him how he was doing. He told me, "I'm actually feeling better than I have in months. I'm not passing out on the couch anymore. I wake up at 7 a.m. every morning without an alarm. I feel optimistic for the first time in months, and it seems to be consistent. This week I've managed to attend 3 social events, and I seem more motivated. My workout game improved too. Also, I'm not sure I'm ready to go back to work just yet, but I've noticed my motivation has picked up. So much so that I've started taking free programming courses online. I just can't believe it." Research on psychedelics for depression. So unfortunately, we can't draw any sound conclusions from Nelson's experience, as scientific data from randomized control studies is still lacking. However, the growing collection of anecdotes on the benefits of microdosing for mental health and well-being has caught the attention of researchers. Thomas Anderson, who is a PhD candidate at the University of Toronto, pulled almost 1,000 participants on social media channels, such as Reddit, to gather some initial data on the benefits and drawbacks of microdosing hallucinogens. The microdosers that Anderson and his team pulled reported higher levels of creativity and improved focus and mood. They claimed to notice a reduction in depression and anxiety symptoms, increased motivation to eat right and exercise, cognitive enhancement, improved self-efficacy, and heightened social functioning. They reported that the main drawback they experienced was obtaining these substances, which are currently illegal in the US and Canada. Although interesting, this self-reported data isn't hard science. To increase objectivity, Anderson and his team presented the participants with tests of creativity, so finding out how many uses they could find for common objects, for example, and questionnaires that measured wisdom. The microdosers scored high in both these metrics. They also scored lower in tests that measured negative emotion. Anderson and his colleagues plan to publish these preliminary findings in a series of papers. They're currently in the process of obtaining Health Canada approval for a controlled study. Psychedelic research was terminated in the 1960s, leaving a massive knowledge gap of their therapeutic potential. But now, with the publication of Fadiman's Psychedelic Explorer's Guide and Michael Pollan's even more recent How to Change Your Mind, psychedelics are receiving a fresh surge of interest, particularly for their mental health benefits. One of the prominent names in this new wave research community is Robin Carhart Harris, PhD at the Imperial College of London, who is investigating psilocybin as a treatment for severe depression. Published in a 2016 issue of Lancet Psychiatry, Carhart Harris administered 2 doses, one small and one moderate, of psilocybin spaced 1 week apart to 12 patients with major depressive disorder. The doses were administered in a controlled therapeutic setting, and the symptoms were rated immediately after therapy and again at 1 month and again at 3 months. The study results were remarkable. 5 of the 12 patients dropped from severe depression to no depression immediately after receiving the second dose. All of the study participants experienced an overall reduction in symptoms, with 5 of the study participants remaining depression-free after 3 months. Roland Griffiths, PhD at Johns Hopkins, is involved in a number of studies examining psilocybin's ability to induce mystical experiences in terminally ill patients. In a 2016 randomized double-blind placebo-controlled crossover trial published in the Journal of Psychopharmacology, he and his team found that administering high-dose psilocybin to terminally ill cancer patients increased mood, quality of life, and optimism, and decreased death anxiety. These benefits were sustained at the 6-month follow-up. Over 80% of the study participants claimed to experience greater life satisfaction and feelings of well-being. How do psychedelics work? LSD, psilocybin, and other psychedelics work like serotonin in the brain by acting on serotonin receptors, specifically 5-HT2A serotonin receptors. Like psychedelics, antidepressant medications like SSRI and SNRI medications, selective serotonin and norepinephrine reuptake inhibitors, Cipralex and Effexor, for example, respectively, also work on serotonin pathways. However, these medications' effects are limited. Some people improve on them while others feel no different, and still others feel worse. SSRI and SNRI medications activate 5-HT1A receptors. According to Carhart Harris, this makes a difference. In his paper on the bipartite model of serotonin signaling, he proposes that these receptor pathways help people cope differently. 5-HT1A receptors, acted on by antidepressants, help with passive coping. They help individuals with depression tolerate the stress in their lives, be it a toxic work environment or a destructive relationship. Nothing has changed about the situation, but it helps them deal with it better. Psychedelic stimulation of 5-HT2A receptors activate pathways involved in active coping, identifying and directly addressing sources of stress. Active coping might mean asserting boundaries at work or applying to new jobs. It might look like ending an unhealthy relationship. In other words, 5-HT2A receptors stimulate neural pathways that reveal previously elusive solutions to problems. They do this potentially by increasing a chemical called brain-derived neurotrophic factor, or BDNF. BDNF promotes the growth of new brain cells and neural pathways in the brain. These processes, called neurogenesis and neuroplasticity, are essential for learning, creativity, and memory. Research shows that increased neuronal plasticity benefits mood, and there's lower levels of BDNF in patients with depression. Psychedelics also work by disconnecting the brain's default mode network. The default mode network, or DMN, connects frontal areas of the brain, such as the medial prefrontal cortex, and lower brain areas like the posterior cingulate cortex. When we're daydreaming, stuck in traffic, sitting in a room, or otherwise not actively engaged in a mental task, our DMN lights up. In these quiet moments, we lapse into a state of reflection and self-referential thinking. In other words, our minds wander. If we're in a good mood, this mind wandering creates narratives, daydreams, and fantasies about the future. But if we're depressed, this mind wandering state tends to lead to rumination, negative overthinking, and self-criticism, which can even worsen mood. Disrupting the DMN allows old thought patterns to fall away, opening up novel possibilities. Psychedelics also work by activating flow states. Shutting off the DMN can help us enter a state of flow. Flow states occur when we're completely immersed in an activity so worthwhile that our sense of time and our sense of self cease. When in flow, we toe the limits of our talents, making these states incredibly rewarding and enriching. They are the antithesis to depression and anxious mood states. Psychedelic substances, along with other practices like meditation, help put us in a state of flow. These states are characterized by elevated levels of serotonin and dopamine and calming and focusing alpha brainwave oscillations. When in them, we become capable of incredible things. In the Psychedelic Explorer's Guide, James Fadiman writes about Clifford, a pre-med student. Clifford shares this. I was taking a biology course to prepare for medical school, and we were studying the development of the chick embryo. I realized that in order to stay alert, a tiny dose of LSD could be useful. With that in mind, I licked a small but very potent tablet emblazoned with a peace sign before every class. This produced a barely noticeable brightening of colors and created a generalized fascination with the course and my professor, who was otherwise uninteresting to me. So, due to some health concerns, this Clifford that Hadman writes about ends up missing the final exam. His professor agrees to a makeup. Before the exam, Clifford pops the rest of the now tiny LSD tablet into his mouth. The makeup exam consists of drawing the complete development of the chick from fertilization to hatching, essentially the entire course. Clifford says, as I sat there despondently, I closed my eyes and was flooded with grief. Then I noticed that my inner visual field was undulating like a blanket that was being shaken on one end. I began to see a movie of fertilization. To my utter amazement, I was able to carefully and completely replicate the content of the entire course, drawing after drawing, like the frames of animation that I was seeing as a completed film. It took me an hour and a quarter, drawing as fast as I could, to reproduce the 21-day miracle of chick formation. Clearly impressed, my now suddenly lovely professor smiled and said, well, I suppose you deserve an A. The gentle wonder of life was everywhere. While impressive, Clifford's account, like Nelson's, is merely an anecdote. Far more research is warranted. Microdosing allows individuals to tap into the 5-HT2A receptor stimulating, BDNF increasing, DMN uncoupling, and flow state activating benefits of psychedelics without the mind destabilizing effects. At a subperceptual dose, there are no weird colors or visuals, alternate realities, or ego deaths. Microdosers report that the world merely appears brighter, that they feel a little bit sparklier, they experience greater well-being, otherwise they can proceed with their lives normally. Fadiman's microdosing protocol consists of taking 1/10 of a full dose, so about 10 to 20 micrograms of LSD or 200 to 500 milligrams of dried weight psilocybin mushrooms every 3 days. This means that if the first dose is taken on Monday, day 1, then the second dose is taken on a Thursday, day 4. According to Fadiman, spacing doses avoids tolerance, keeping the doses effective when you take them. Participants are encouraged to engage in their daily activities, working, eating, sleeping, and exercising normally. Fadiman also recommends patients or participants keep a record of mood, cognition, motivation, and productivity. People often report that they feel the best on day 2, the day after taking a microdose. Of course, there's drawbacks to microdosing. In my role as a naturopathic doctor, I can't recommend or counsel on the use of psychedelic substances for the treatment of any health condition. While the scientific interest in their use as therapeutic agents is growing, these substances are still illegal to obtain and illegal to possess, and there is a lack of solid research on their safety and efficacy. As of right now, the only way to legally access psychedelic therapies is through research. MAPS, the Multidisciplinary Association for Psychedelic Studies, often lists recruitment opportunities for ongoing studies. Thomas Anderson, previously mentioned, at the University of Toronto, is in the stages of obtaining Health Canada approval for a randomized controlled trial on the benefits of microdosing in healthy volunteers. Like all therapies, there are risks to taking these substances, even at low doses. While LSD and psilocybin confer a low risk for addiction and are 10 times less harmful than alcohol, so for example, the harm scores of LSD and psilocybin are 7 and 5 respectively, compared to a harm score of 72 for alcohol. They're not completely benign. Psychedelics can aggravate schizophrenia, psychosis, dissociation, severe anxiety, and panic. They can also interact with medications and supplements that act on serotonin pathways. Their effects at high doses can be disorienting and oftentimes unpleasant, that bad trip. In the studies that showed positive benefit, they were administered under careful supervision in a therapeutic setting. However, our society's mental health is in crisis. As a clinician who focuses on mental health, I'm always excited to learn of new therapies that have the potential to heal mood. With Canada's 2018 legalization of cannabis, I believe that gateways are opening for future uses of psychedelics as medicine and for the potential of future legalization of psychedelics. Perhaps with more research and advocacy, we'll one day see microdosing of psychedelic substances as a safe and effective mainstay therapy for promoting mental and emotional well-being. I'm Dr. Talia Marcheggiani, and that was Microdosing Psychedelics for Mental Health.